So today I'm going to be conducting a lower quarter screen. So to start off, assessing the patient's posture in a standing position, I would first palpate for the iliac crest as well as the ASIS to make sure that the pelvis is in line. I would take a look at the patient's patellas to make sure that they're both equal and there's no abnormalities, and look at the relation between the femur and the tibia and the patella as well. Then I would assess from a side view and take a look at the greater choke and look at his popliteal surface to see if there's any knee hyperextension. Then moving to a posterior view, I would again palpate for the iliac crest, the PSIS, the gluteal folds I would take a look at, the popliteal surface, I would take a look at the calf sizes to make sure that they're both symmetrical, as well as the Achilles tendon, and I would look at the feet to make sure there's no excessive rotation. So now what I'm going to have you do is please cross your arms for me, and hinging at your hips, I want you to bend back at the hips as far as you can go. Good. And you can relax this. Now I want you again hinging at the hips, bend forward like you're touching your toes. Very good. Okay, so now I want you to take your right hand, put it on your thigh, and slide it all the way down to your right foot, as far as you can. Good. Now on the opposite side. Very good. So now I want you to cross your arms again for me, and what you're going to do is point your feet inwards, your toes towards each other to lock those hips, and I want you to rotate to the right as far as you can go. Very good. And now to the left, please. Very good. Okay, so now we're going to be, can you look this way for me? We're going to be doing resisted side bending. So I want you to put your arm across your chest, and I'm supporting at the hips and the ankle, and don't let me move you, okay? Very good. Now the opposite side. Don't let me move you. All right, very good. Okay, so now facing me, I want you to grab onto my hands for stability. So I'm going to have you do heel raises on each of your feet, 5 of them. So you can start that now. Okay. This is the S1, S2 myotome, also on the opposite foot too, assessing the patient's coordination and standing balance. All right, good. So now again, holding onto my hands, I want you to kick your leg out as far as possible to the side, and with the other one. Good. Now I want you to bring your knee and your hip and point your toes all the way up as high as you can. Good, and on the opposite foot. Good. And now with a straight leg, I want you to point your toes and bring your leg all the way back. Okay, and on the opposite one too. All right, very good. So now, can you please put your shoes back on for me? All right, so I'm gonna have you sit on the table. So what we're going to do now is I want you to cross your arms across your chest. First I would take a look at the patient's posture. Again, palpate the ASIS, the iliac crest. Make sure his pelvis is level. Take a look at his patellas, his tibia and femur. Make sure everything's in line, everything's straight. So now what we're going to be doing is applying some passive overpressure and rotation. So I'm going to bring you here, and I'm just going to apply some passive overpressure. Very good. Stabilizing at the hip. On the opposite side. Good. Okay, so now I want you to stay like this, and I'm going to try to rotate you both directions. Don't let me move you. Very good. And here. Very good. Okay, so now bringing your knees together, stabilizing at the knees and your back. I'm going to again try to bend you forward and backwards. Don't let me move you, okay? Very good. I'm going to put my arm across your chest. Very good. Okay, so now you can put your hands at your side, and I want you to lift your knee up as high as you can, stabilizing at the shoulder, and this is going to be the L2, L3 myotome, resistless pressure. Good. And the opposite side, resist that. Okay, very good. Now what I'm going to do is test the L3 patellar reflex. So palpating for the patellar tendon. Making sure both sides are equal. Okay, great. So now what I have you do is lie on your back for me, please. Do you mind if I remove your shoes?
No.
Alright. You can scoot over to me, please. So the first thing I'm going to be doing an SI joint compression as well as a distraction to see if we could reproduce any pain or symptoms. So let me know if you have any problems.
No.
Feel fine? Okay. Now distraction. Anything? Okay, good. So now we're going to be doing is single leg raises. So first I want you to point your toes towards the wall. You can relax your leg. I'm just gonna bring it up for you. Any pain or anything? Okay, now point your toes towards you, please. Same thing. Let me know if there's any pain or anything. Okay, now this time when I bring your leg up, keep pointing your toes towards you. Bring your head up off the table at the same time. Bring your chin to your chest. Any change?
No.
Okay, good. So now we're gonna do that on the opposite side for comparison. So pointing your toes out. Any pain? Point your toes towards yourself, please. Very good. Now again, this time you're gonna be lifting your head up too, okay? With your toes pointed. Anything?
No.
Good? Okay. So now what I'm gonna do is do some myotome testing on his feet. So the first thing I'm gonna have you bring your foot up just like this, stabilizing at the ankle, resist this motion. This is the L4 myotome on the opposite foot too. L4, okay, now great toe resistance. Don't let me move you. This is gonna be L4, L5. Okay, and on the opposite foot. Okay, now we're gonna be doing ankle eversion. This is gonna be L5, S1 myotome. Don't let me move you. Again, don't let me move you. Okay, very good. Now we're gonna be testing the patient's sensations. So I want you to close your eyes. I'm gonna be touching you in 2 spots. Let me know if it feels the same on both sides. So the L3 and the L4 dermatome. Feel that? Good. Okay, now the medial malleolus, the L4.
Same.
Same. Okay, the dorsum of the foot, the L5.
Same.
Okay, the lateral malleolus, the S1.
Same.
The posterior calcaneus, the S2.
Same.
Same? Good. Okay, so now what I'm gonna have you do is lie on your stomach for me, please. Right, so we're gonna start off with, again, an assessment of the patient's posture here. We're gonna be looking at his hips, his PSIS, his gluteal folds, the popliteal surface, calf size, as well as the Achilles, and to see if there's any rotation at the foot. So the first thing I'm going to be doing is a passive knee flexion, so you could just relax. Good. And then on the opposite side. Very good. Okay, so now I'm going to be doing resisted knee extension, which is going to be L3. So don't let me move you. Very good. Now we're going to be doing it on the opposite side, L3. Okay, good. Now we're going to be resisting knee flexion, which is going to be S1, S2 myotome. Don't let me move you. Very good. Now the same on the opposite side. Don't let me move you. Very good. Now I'm going to be assessing the patient's patellar reflex, the S1, S2 reflex. So putting the Achilles reflex, excuse me. Putting it on a stretch now. Okay, very good. Very good. So that concludes the lower quarter